Bonsoir et bien.
Good, good evening and welcome to this live broadcast of Pfizer BioNTech Comirnaty vaccine for COVID-19. My name is Bruce McFarlane. I am joined tonight by Dr. Jennifer Russell, Chief Medical Officer of Health for New-Brunswick, and Dr. Rachel Ouellette, a General Pediatrician in Fredericton. Thank you for joining us for this session hosted by the Government of New Brunswick. Dr. Russell and Dr. Ouellette are here to discuss the vaccine for children aged 5 to 11 years.
Ladies and gentlemen, welcome to tonight's live stream on the Pfizer BioNTech mRNA vaccine for children. My name's Bruce McFarlane, and I'm here tonight with Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and Dr. Rachel Ouellette, General Consulting Pediatrician. The doctors are in the house tonight to talk vaccines for children 5 to 11 years old. And we're going to start off, and I'm going to say welcome. Bienvenue à vous deux.
Welcome to both.
Don't worry if things are happening at home and people are acting up. We are recording it. It will be posted so you can watch it at your convenience. We decided to do it this hour so that parents and children and everyone else can join in. Hopefully this time does work for everybody. But again, it will be recorded so if you miss anything, you can catch up. So the first question, we're going to get right into it. We did put an ask out for questions through our social media. On a fait l'appel pour.
We have asked for questions through the social media.
We got a lot of repeat questions, so we've molded them together. Voici la première question.
This is the first question. This question is from Geneviève. When it comes to the first children vaccinated and side effect data, how long have they been studied? Since when are the studies done to know what can come out or not? Dr. Russell. The vaccines, the mRNA vaccines were tested in children in 3 phases, and through clinical trials, they compared the safety and efficacy of the vaccines to a placebo or a fake vaccine. They also compared safety and efficacy in different age groups. In March 2021, Pfizer and BioNTech dosed the first healthy children in an ongoing global phase 1, 2, 3 to see if the vaccine can produce an immune response against COVID-19 and if it is safe in children aged 6 months to 11 years. The mRNA vaccine technology is not entirely new. Although the COVID-19 vaccines manufactured by Pfizer BioNTech are the first mRNA vaccines to go through all stages of clinical trials and be licensed, the technology has been around for some time. Researchers have been studying and working on mRNA vaccines for decades. As an example, the use of this type of vaccine has been studied to combat influenza, Zika virus, rabies, and cytomegalovirus, CMV. Since 2011, researchers have also used mRNA technology to trigger an immune response against certain cancer cells and for human cancer vaccine trials. It is true, and the independent process from Health Canada is recognized worldwide for its high standards and rigor. Decisions are based only on scientific and medical evidence that show that vaccines are safe and effective. The benefits must also outweigh the risks. As the COVID-19 vaccines are administered in Canada, Health Canada continues to monitor their safety. The Public Health Agency of Canada, Health Canada, and provincial and territorial health authorities continue to closely monitor the use of all COVID-19 vaccines to review and assess any new safety concerns. Well, first question.
Ouellette.
Mon français, ça.
My French is progressing.
First, I think this is our fourth or fifth, Dr. Russell. We've done these types of live streams on mental health, vaccines. We did one with Dr. Tobin recently when the vaccines came out, and obviously at the beginning when COVID arrived in
2020.
2020. So we're going to get to the next question. This one came from Heidi. Why is there an 8-week interval between the pediatric dose versus 28 days for the adult? Dr. Russell.
So Health Canada has approved the 2 doses of the Pfizer-BioNTech oh my goodness, it is hard to pronounce, Comirnaty, COVID-19 vaccine to be administered with a minimum of 21-day interval. However, the National Advisory Committee on Immunization has reviewed the emerging evidence on the ongoing positive impact of longer intervals between the first and second doses of a 2-dose COVID-19 vaccine series. So the data shows that by extending the authorized intervals by several weeks, it leads to even a higher immune response and better protection against COVID-19 infection, and that is also expected for it to last longer. So therefore, New Brunswick has decided to follow NACI's recommendation to offer vaccines at the optimal interval of 8 weeks between doses of mRNA COVID-19 vaccines.
La prochaine question.
The next question. Why give this vaccine to children if, according to you, since the beginning of the pandemic, they are not at risk of developing serious symptoms of the disease? Dr. Ouellette? Well, whereas some of the cases in children with COVID-19 are mild and asymptomatic, some of these children become very ill and end up hospitalized and in rare cases might die. The long-term complications or symptoms of COVID-19, for example, chronic fatigue, shortness of breath, difficulty concentrating, can last for months after infection, and those who suffer from them are commonly referred to as COVID-19 low-termers. Vaccination against COVID-19 also reduces the spread of severe COVID-19 in the community, like for the elderly, the immunocompromised, and those who cannot be vaccinated, the youngest under 5 years old now. It also helps prevent the spread of other variants of concern from developing.
Others, and I take it your children are vaccinated. Dr. Ouellette, you have young children. I believe your children were immunized last Friday. Do you want to just share how that went and how did you prepare for that?
So my boys are 5 and 6, and we started conversations when I got my first vaccine that they would get it eventually. And flu vaccine happened a few weeks ago, and we prepared for that. The 6-year-old did great, the 5-year-old.
Okay.
But we prepared for this one, and we had things sorted out, like giving him some control. What video are we going to watch? What stuffy are you going to bring? Which arm do you want? We had it all figured out. It didn't work out that way.
But they did get immunized.
They totally got immunized.
Your children are what, teens? So when did they?
Yeah, so I have an 18-year-old and a 16-year-old, and they both felt a little bit tired after the first dose, and I believe my son did have probably longer lasting kind of symptoms after his second one, but overall they sailed through it.
Here's a good question that came in from Tim. Any idea when 5 and under will be approved, or if there are any trials that we could take part in? So, Dr. Russell?
So according to NACI, the National Advisory Committee on Immunization, Health Canada is anticipating submissions from Pfizer, BioNTech, Comirnaty in the following months for 6-month-old to 4-year-old children. So additional age groups could become eligible early next year. And a number of vaccines are being developed in Canada, and healthy volunteers and COVID-19 patients in Canada may be able to participate in clinical trials.
Our next question came in from Colleen. With the Omicron variant, would you suggest waiting to vaccinate your children until Pfizer has tweaked their vaccine to be effective against this variant, or will they need an additional vaccine later? Dr. Ouellette?
So at this point, there's no reason to wait to get the vaccine. The longer you wait, the longer your child is unprotected from the current variants. And delaying vaccination means your child is susceptible to getting COVID-19 right now. The current Pfizer-BioNTech Comirnaty COVID-19 vaccine is highly effective to protect these individuals. Vaccinations are one of the best of, but not the only protection we have against the virus and its variants. The key message from the World Health Organization's Dr. Peter Singer is to use the pandemic public health tools available to you for best optimal protection, meaning getting all your shots, and if a third one is made available to you and you are eligible, get it, safe physical distancing, properly worn masks, following public health measures. During the clinical trials of the vaccine, children had a comparable immune response compared to people 16 to 25 years of age. So how long the protection will last is currently unknown.
As a pediatrician, seeing parents with their young ones, how long has this been a topic of discussion with parents of your patients?
For COVID vaccination or,
Yes.
or vaccines in general?
Both.
I mean, vaccine hesitancy is not new to my practice, but COVID-19 vaccination has definitely been a topic of conversation since the adults were vaccinated. Some are super eager to get their kids vaccinated even before it's available to them, whereas others are still very hesitant.
Dr. Russell, this is from Jeremy, and he asks, if this vaccine is only 25% effective in adults, what is the effectiveness percentage for children?
So there's so many percentages floating around out there. Let me just clarify that the vaccine effectiveness against severe symptoms, hospitalization, ICU admission, and death is above 90% in adults, and it's the same for kids. So for kids that are 5 to 11, it's 90.7% effective against severe symptoms, hospitalization, ICU admission, and death. What the vaccine does do in terms of, it does reduce your risk of getting COVID by about 25%, but it doesn't prevent you from getting COVID. It prevents you from getting very, very sick with COVID.
This next question came in from Robbie. Are the doses determined by weight or just by age? My little guy is 11 years old and only weighs about 55 pounds. He has friends that are twice his size. How do I know he is really getting a safe dosage, and how can an 80-pound 12-year-old get the same dosage as a 200-pound 19-year-old? So
that's a very good question. And it's true that in pediatrics, much of our medication doses are weight-based, but vaccine doses are not based on weight, or most of them are not. They are based on an individual's immune system. We actually know that kids' immune systems are quite robust, and so they often need they could get the same response from a smaller dose. And so that's how I think they got to this point, by using a smaller dose. So one goal of vaccines developed for any age is to find the smallest level of antigen, and that's that part that triggers an immune response in our system to maximize the protection without side effects. For some vaccines, adult and child doses can be the same, like the flu shot. A 6-month-old is getting the exact same shot as a 500-pound man. But in other cases, like with hepatitis A vaccine, or adults are getting a higher dose than children. So in the clinical trials, Pfizer-BioNTech determined they were able to use a lower dose in children and could still get that same immune response and effectiveness as the adult immune response with a slightly higher dose for the adults.
So it's not based on weight.
Nope.
Good, I'm glad. If you're just joining us, welcome to tonight's live stream. We are talking about the Pfizer-BioNTech Comirnaty mRNA vaccine for children in New Brunswick. My guests tonight are Dr. Jennifer Russell. She's the province's Chief Medical Officer of Health, and Dr. Rachel Ouellette. She's a general consulting pediatrician here in Fredericton. Bonsoir, mesdames et messieurs.
Welcome, ladies and gentlemen. Thank you for being here with us today. I'm here with Dr. Jennifer Russell, Chief Medical Officer of Health, and Dr. Rachel Wallet, a general pediatrician in Fredericton, and we're speaking about the Comirnaty vaccine for children from 5 to 11 years.
This question is quite the long one, so here we go. Children who turn 12 by the end of this year are fully vaccinated with 230 microgram doses. But children who turn 12 the beginning of the year will only be getting 210 micrograms. My question is, what is the government planning to give these children who are turning 12 after next month? The same level of protections as children who turn 12 by the end of this year? Will there be a booster? Also, since Pfizer, the CDC, and Health Canada have approved the pediatric doses for 28 days apart, will children in New Brunswick have to wait 8 weeks that Nancy said is up to each province, or we will allow them to have them at 28 days? Dr. Russell.
Okay, so the vaccine for children aged 5 to 11 has a smaller dose than the vaccine for those 12 and older. And this is because healthy children, as Dr. Willett mentioned, have a very strong immune system compared to youth and adults. And in clinical trials, lower doses provided children with very good protection against COVID-19. And it's not clear yet how long that protection will last. However, New Brunswick will continue to monitor the NACI guidance and recommendations as the pediatric COVID-19 vaccines are rolled out.
Here's another question that was very popular and came in several times, and we sort of condensed it down into all of this one. Are children aged 5 to 11 allowed to make the informed decision on whether or not they want the vaccine? Dr. Russell, would you like to touch this one?
Sure. So under New Brunswick's Medical Consent for Minors Act, minors who have reached the age of 16 can consent to health care in the same way as if they had reached the age of majority. So in New Brunswick, a parent or a legal guardian needs to consent to immunization for minors younger than 16.
Okay. This was also a very important question that came in several times. Quels sont les
What are the common side effects for children?
side effects for children? Dr. Willett, we'll start with you.
Okay, and I'll start in English. So children typically experience mild to moderate side effects that are similar in nature to those experienced by adults. The side effects should only last a few days, and clinical trials of the vaccine showed no serious side effects for this age group. Most side effects are easy to manage with rest. Some of the following symptoms may occur after your child's vaccine. So fatigue, they may be feeling a bit uncomfortable, sick, or even miserable, and the best remedy for these side effects is rest. My son that got vaccinated last Friday, we cuddled all day Saturday, and he doesn't usually let me do that. So take it in, enjoy it.
Bonus.
They may get aching muscles and joints, and so that can be treated with Tylenol or Advil if you wish. And they should probably avoid strenuous activity if their muscles are hurting. Headaches, so pain in or around the head, neck can make anyone feel irritable, especially these kids. So cool washcloth on their forehead, dimming the lights a little bit, avoiding screen time in this situation might make it easier for them, and just making sure that they're hydrated. The site of the injection can obviously be affected. It can be sore, red, maybe a bit swollen for a few days. But again, a cool washcloth on the area. You can also use acetaminophen or ibuprofen. They might have chills or fever. It's typically low grade though. And so in those situations, just get your kids to wear kind of lighter clothing and cuddle up with them. You can use fever-reducing medications like acetaminophen or ibuprofen, but really important that you don't use aspirin. There's a completely separate problem that can affect any child that takes aspirin under the age of 18 called Ray's syndrome. Just wanted to touch on something that some people like to give Tylenol or Advil before vaccinations. That's not something I typically recommend for any vaccination because they may not need it. So of my two kids, one was completely fine, wouldn't have needed it, and one got it when he had the symptoms. So best to avoid giving the medication until you see what symptoms you're dealing with.
En français?
En français,
In French now, it's because it's very important. We do it in 2 languages. The side effects in general, children typically experience mild to moderate side effects that are similar in nature to those experienced by adults. Side effects should only last a few days. And the clinical trials of the vaccines showed no serious side effects. Most side effects are easy to manage with rest. Some with your mom, as Dr. Wallet said, some of the following symptoms may occur after your children's vaccination. Fatigue. In general, your child might feel uncomfortable, sick, and miserable. The best remedy for these side effects is rest. This might be a good time to read a good book with them or watch a movie. Aching muscles and joints. Any achy body can also be treated with rest. Avoid strenuous activity until symptoms improve. Headaches. Pain in or around the head and neck can make anyone feel irritable, especially children. A cool or warm washcloth on your child's forehead or neck can help a headache. Dimming the lights and avoiding screen time may also help. Ensure your child is well hydrated and encourage regular sips of water. Injection site discomfort. The injection site area can be sore, red, or even a little swollen for a few days. A cool washcloth or over-the-counter acetaminophen, Tylenol, acetaminophen, it's funny, can help ease the pain. Chills of fever. For low-grade fever, encourage your child to wear lighter clothing. Fever-reducing medications such as acetaminophen or ibuprofen may be used with the advice of your health care provider. You should not give aspirin to children under 18 years old because of the link to Ray's syndrome.
The world is terrified of needles. It's stopping from booking an appointment. How can and should we deal with this, Dr. Boulette?
Solidarity, my friend. My 5-year-old is too. That cute little video of the 2 boys, those are my boys. That's not how it went down, though. I actually wondered if we should run a blooper reel just to prove that even pediatricians' kids are afraid of needles too. So it's very common for kids to be fearful of needles. There are different things you may want to try to reassure your child. Being afraid of needles, there's a name for it, trypanophobia, is a common anxiety that can trigger intense feelings of panic, nausea, weakness, and fainting. And as a parent, watching your child struggle with that is hard. It's painful for us too. And I have to tell you that in the moment when my 5-year-old was having a giant panic attack and I was trying to pin him down, I actually thought about scooping him up and running. Did I all of a sudden doubt the science? Not at all. But my mom heart was threatening my pediatric brain. But we prevailed, we got it done, and we didn't have to go through that again the next week. And he still loves me. He got Skittles, and, and we're talking about how we're going to make the next one easier for him and for me. But let's help your child by focusing on the facts. So don't talk about the what ifs. Talk about what will happen, what they'll see, what the process is. Reframe what your child's thinking. So help your child consider the vaccination as a protection because the risks associated with COVID-19 are much worse. Help your child focus on the vaccine's benefits and the things they can look forward to after vaccination. My older son, I said, maybe we can go on a plane sometime. And I said, where do you want to go? And he says, I don't know, Mommy, you choose. Great.
So?
Make a plan. So bring a support person. And actually, if you yourself are anxious, don't join that child's chaos. Send somebody who can support the child instead of heightening the child. Let the clinic know that your child has a phobia. Bring distractions. You can bring that iPad or the iPhone. You are allowed screen times in those moments. Bring a teddy. Bring anything it needs. You can bribe them. I'm okay with that. You can also talk to your doctor or your pharmacist, because there are some topical anesthetics to numb the area before vaccination. To be honest, it doesn't numb the muscle. It's still going to hurt. Please tell your child that it may still hurt. Lying to them does not help. But it may help as at least an initial placebo, or a sense of control that there is going to be some numbing to the skin. You can talk to your healthcare professionals about medications to help manage anxiety, but that is definitely something we avoid in this age group if possible. You can help to reduce the pain of the needle pokes by applying that topical anesthetic I talked about. Again, available over the counter. You don't need a prescription for that. It comes as a cream or a patch. What else? You can... I guess that cream, it's important to apply 30 to 60 minutes before arrival, so you have to plan for that. The other thing is just when you call or you book your appointment, let the staff know that their child is anxious. They'll try to find a good space and give you a little bit of extra time. The other thing, there's something going around, there's resources on the GNB website about cards. So C for comfort, A for ask, R for relax, and D for distract. We use this a lot in the hospital emergency department and up on pediatrics to try to get kids through painful procedures. Talk to your child before the visit about what to expect. You do have to tell them it's going to hurt. It does. I mean, but it's going to be short-lived. And then comfort your child during that appointment. If you try all of these things and still your child is unable to take the vaccine, you can reach out to your primary care provider, who may be able to refer your child for further supports. Stay strong, parents. This one's worth the fight.
You brought it up. I thought I saw 8 packs of Skittles in your husband's coat pocket. You opened the door. You opened the door. I'm just... Dr. Russell, why vaccinate kids who aren't at risk?
Great question. I think most parents want to know, what is the value in getting vaccinated? What is the risk of my child having a side effect from the vaccine? What is the risk of my child getting COVID and having severe symptoms? But above and beyond that, we also have to think about transmission from your child to other adults who may be immune compromised or people who can't get vaccinated, and protecting our community and protecting our healthcare system. So when we look at vaccination of children aged 5 to 11, we have to really think about what's really important. And again, forefront of parents' minds, I'm a parent, is what is the risk to my child of this vaccine? Is it worth the risk compared to what the risk is for getting COVID? And we can say as physicians that the risk of getting COVID and having severe symptoms can happen. Dr. Willette has the numbers. She can pull them right out of her head in terms of, how many cases that have had to be hospitalized across the country in this age group, 5 to 11, how many have had to be admitted to ICU, et cetera. So we know it can happen, and we know that they can also have long COVID symptoms. So, and with variants of concern emerging like Omicron, we're seeing increasing cases of COVID-19 in children, even with the Delta variant here in New Brunswick. So approximately 30% of cases that were reported since September 1st, 2021 are among youth under 20. Vaccination against COVID also reduces the spread in the community, as I mentioned, for individuals who are at risk of severe COVID, such as the elderly, such as immune-compromised individuals, and individuals who can't be vaccinated. So it also stops the spread of other variants of concern from changing into another more infectious variant.
Right. I saw your questions too. I was monitoring, and I saw that question come up a lot. Like, what are the actual numbers? Because in New Brunswick, we're not necessarily seeing that because our numbers are smaller than the rest of the country. But the Canadian Pediatric Society created documents for us to share with parents, and one of them gives those numbers. And if it's okay, I'd like to share those. As of November 12th of this year, there were, for this specific age category, only 5 to 11-year-olds, there were 299 admissions, there was 48 ICU admissions, and there were 2 deaths. And to me, 2 is too many. If we can protect our children from that,
This is COVID, right?
This is admissions with COVID. This has nothing to do with the vaccine. This is before our 5 to 11-year-olds had access to vaccines. And 2 is too many.
Dr. Ouellette, here's a question. Am I understanding that a 5-year-old receives the same dose as almost a 12-year-old? I know we answered it, but this is where you get into micrograms and
Yes.
what?
Yes. So it doesn't matter what size the 5-year-old or the 11-year-old is. Everyone in this age category gets the dose of 10 micrograms, which will be drawn up as 0.2 milliliters given in the upper arm. So depending on the size of your child, a different needle size may be used for a 5-year-old than a 12-year-old, but it's still the same dose that gets drawn up. And it is a third of the dose of an adult dose. Again, COVID-19 vaccine is not based on weight. Vaccines are based on an individual's immune system. And one goal of vaccines developed for any age is to find the smallest level of antigen that can trigger that immune system to maximize the protection without side effects.
Dr. Russell, y a-t-il des cas d'effets secondaires importants de vaccins chez les enfants? Les enfants en général ont des effets secondaires légers à modérés qui sont de même nature que ceux ressentis par les adultes. Les effets secondaires ne devraient durer que quelques jours. Les essais cliniques du vaccin n'ont révélé aucun effet secondaire. La plupart des effets secondaires sont
That goes back to how children's immune systems are so strong, and that small 10 microgram dose is all it takes to stimulate that immune response to give that protection for COVID-19. And the Government of Canada will continue to monitor the safety and effectiveness of the COVID-19 vaccine in the 5 to 11 years of age group very closely, both in Canada and internationally, and will provide updates as data continues to emerge. And in addition to Canada's strong COVID-19 vaccine safety monitoring system, Canada also has a safety surveillance system specifically designed for monitoring pediatric vaccinations. So this system is called the Canadian Immunization Monitoring Program, ACTIV or IMPACT, and it's been used to monitor the efficacy and safety of childhood immunizations for more than 20 years.
Can I ask a question?
Excuse me?
Can I ask a question?
Well, go get out your phone and type it in.
I'm just thinking of those, we must be up to 3 million now vaccinated in the States for this age group, right? How quickly would we learn in Canada about those side effects? I feel like it's quite rapid, isn't it?
I feel like even if it wasn't through those types of reporting systems, the manufacturers themselves offer that information when they see a signal, either in the trials or post-trials. So I think we would hear about that very, very quickly in any of those routes.
And that's how we learned it with the 12 to 18-year-olds, didn't we?
Yes, exactly.
And I mean, we learned that there were some side effects for those youth, but once we learned about it, I think they were able to adjust and support it as quickly as they could.
Right, in terms of giving people a heads up and letting them know ahead of time to watch for it. I think you're talking about the pericarditis and myocarditis, and so obviously there's a range of severity in those types of symptoms as well in the upper teens and in early adulthood in that age group, and it was mostly boys and men. And so, yes, of course, so that helps us adjust, you know, again, did it happen after the first dose? Did it happen after the second dose? And what steps do we need to take to, again, let people know ahead of time? It's not necessarily going to discourage or prevent people from getting vaccinated, but having that information and that knowledge is really important for people to make decisions and then prepare for that. But in this age group, 5 to 11,
Oh, no.
none, like just very mild,
They
moderate.
found that dose and that
Yeah.
interval that seems to.
Yeah, and that's, the beauty of the children's immune system, because it really does take that very, very small dose to stimulate a great immune response.
Love it.
If you need a quick pause to sip on some water, I'm going to give out some interesting stats. So when we opened up the scheduler for the Regional Health Authority community clinics, it's been a week to allow parents and guardians to book appointments for 5 to 11. So as of this morning at 8 o'clock, 12,750 registrations for children have scheduled for an appointment. And already we have 4,864 children between 5 and 11 have received their first dose. And that's up 959 from yesterday. And an interesting tidbit is pharmacies are starting to receive their vaccines starting today, going right through December 8th. And parents and guardians looking to book an appointment for their 5 to 11-year-old child can book through a regional health authority community clinic, or they can check our website, gnb.ca, and see the list of participating pharmacies. So that's great news, and we are going to go to the next question. Can you give me one good reason why any child from 5 to 11 should be injected? Donnez-moi une.
Please give me one good reason why any child from 5 to 11 should be injected.
Roulette.
Sure. Vaccinations are important for children. It has been the best defense in many of our infections and viruses for so many years. With variants of concern emerging, like the Delta and the Omicron variants, we are seeing increasing cases of COVID-19 in children in New Brunswick. As already mentioned, approximately 30% of the cases reported since September are among youth under 20. So vaccination against COVID also reduces the spread in the community for individuals who are at risk of severe COVID, like the elderly and the immunocompromised and those that can't get vaccinated. It also helps stop the spread of other variants of concern from changing into another more infectious variant. The more virus that is floating around in our community, that virus is so smart and will mutate before we can eradicate it.
Yeah, we're seeing that, again, what we've seen recently emerge with Omicron. So we're keeping our eye on that very, very closely. La vaccination.
Vaccination is important for children. With variants of concern emerging like the Delta and Omicron variants, we're seeing increasing cases of COVID-19 in children in New Brunswick. Approximately 30% of cases reported since September 1st, 2021 are among young children under 20. Vaccination against COVID-19 also reduces the spread of the community for individuals who are at risk of severe COVID, the elderly, the immune-compromised individuals, and individuals who cannot be vaccinated. It also helps stop the spread of other variants of concern from changing into another more infectious variant.
Dr. Russell, are you planning outreach support to parents who are trying their best to protect their children, families, and communities through vaccination, just like all the other health measures taken that are impossible to be 100% certain, especially when they are inundated by anti-vaxxers?
So parents want accessible information, they want up-to-date information, they want credible information. We have many, many resources to provide that information on our website. You can go to Public Health Agency of Canada, GNB, NACI, and we are providing support to parents by giving them a platform to ask questions here, like we're doing today, and providing evidence-based information through this particular event, but also they can also get this information through their healthcare providers, pharmacists, family physicians, nurses. Again, go visit the GNB website, gnb.ca/COVID-19. Get the facts page, that's for more information about the Pfizer-BioNTech COVID-19 vaccine, including frequently asked questions, pre-vaccine information sheets, and aftercare sheets with more details about the vaccine. And again, it's really important to get those questions asked so that you can make informed decisions and make the best choice for your family and for your kids and for your community.
Do you have a go-to place there, Dr. Woulette, that you tell parents or friends?
So I've been sharing some of that stuff on my own Facebook page, but the GNB website is legit. Sorry, I keep going to it because I'm like, okay, this is a good one. This is a good one. Every now and again, I find different places, like the University of Waterloo has these really cool like coloring sheets for kids while they're waiting, and but no, it's out there. I think if you find a province-based or university-based site, they're not going to share discredited information to you. So
Okay.
Google's not my first, though.
This next question came in from Ashley. Will children aged 5 to 11 unvaccinated lose out of extracurriculars or entering certain establishments? Dr. Russell.
So what we really know right now about the vaccination rollout is that these are measures that are going to protect individuals, your children, from getting COVID-19. We know that masking, distancing, cleaning, disinfecting, coughing into your mask, staying home when you're sick and getting tested. Each of these measures, when they are adopted, acts as a layer of protection for children. And proof of vaccination is not required in New Brunswick for those 11 years of age and younger to access businesses, services, and events.
Dr. Russell, every week you take part in a weekly call with your colleagues from across Canada, all the other chiefs. What is discussed during these calls, and was this a topic how long has this topic been sort of on the radar with your fellow chiefs across the country, the 5 to 11? I know it was a pretty preoccupation. Can you just, did this come up often in your weekly calls?
So first off, when we talk about the school system and children's education, we're talking about an environment and things that happen in that environment that are so important and vital for their development and their mental health. So everything that can and should be done to protect that environment so kids can go to school safely, definitely very, very, very hot topic of conversation repeatedly. How to protect that space so that children can learn and have access to all of those things that help them thrive and flourish. So within our school system, masking is one of the many layers of protection in place to reduce the risk of transmission, number one. And the strength and number of protective layers that rely on risk assessments that take many factors into account. And they don't solely rely on the vaccination rates of the children who attend the school. So the risk level within each school is also a reflection of the amount of COVID-19 transmission within each student's home, as well as within the broader community. And we all have a role to play in reducing the risk for schools because our collective immunization rates provide a population level protection. So getting to a point where we can remove our masks in schools and in public places when we gather with others from outside of our household will be a community effort. I don't think I could give a timeline on that. Again, with this new variant of concern that's just emerged, we have a lot to learn about that and what kind of measures may be needed above and beyond what we already have in terms of protecting ourselves from those types of variants.
Well, that went quick. Time is up. Merci beaucoup à vous deux.
Thank you very much, Dr. Russell. Thank you, Dr. Woulette. Do not forget, this conversation is recorded and will be on our YouTube channel, gnb.ca. If you missed something or if you want to share this session with your friends.
Russell, for joining us tonight. Time flew by, lots of questions, lots of great information. And if you missed anything or you think it's been very good, you can always go to our YouTube channel at gnb.ca and you can share this with your friends and family. Merci beaucoup. Thank you.
Thank you very much.
The crew, to our translation team, and everybody at home for watching. Merci beaucoup et bonsoir.
Thank you very much and good night.